Hello everyone, this is Dr. Padmanabha Verma, Consultant Endocrinologist, SLG Hospitals. In this video, we'll be talking about what are the common sleep problems diabetic patients will face and what are the common causes for that and how to identify and how to treat those things. So in our day-to-day practice, we see many diabetic patients complaining about the lack of proper sleep or they're taking a lot of time to go into bed, go into the deep sleep. So what are the common causes? One is the uncontrolled sugars. Because if they don't have sugars under control, then night time they'll have to get up frequently to pass urine, because most of the uncontrolled diabetic patients will have polyuria, increased frequency of urination. So if you need to get up for every 2 hours or every 1 hour to pass urine, then obviously they'll have a poor quality of sleep. And other common cause is the hypoglycemia, low blood sugars. Whenever patient have low blood sugar, they suddenly develop palpitations, sweating, and they'll sometimes have nightmares also. So they'll have a poor quality of sleep the whole night. So you have to prevent that part also. And the other common thing is most of these chronic diseases, not only diabetes, any chronic disease, the people dealing with chronic diseases, because of the multiple reasons, like one is the financial burden and one is they have to take multiple medications, and they have to, if diabetes, so they have to take multiple injections daily. So these things leads to a depression and anxiety. So depression and anxiety many times causes poor sleep quality. So we have to deal with this. Sometimes if really bothering you, then you have to take a professional help to treat this depression or anxiety. And one more common is the obstructive sleep apnea. So many people you see, especially those who are diabetic and obese, they'll be snoring in the night. Suddenly they'll snore and suddenly stop. So they'll have a kind of arousal. They'll get up. They physically they won't get up, but because of snoring of some time, the blood supply, the oxygen supply delivery to the brain will decrease, called what we call hypoxia. Then suddenly they'll get up. They'll get up means they don't get up physically, but like arousal, sleeping. This kind of pattern will continue throughout the night. That's why in the morning they'll feel like tired. Their sleep is not adequate. So that's why in the daytime also, when you're sitting and doing the job or sitting idly watching TV, they'll sometimes dozed off. They'll suddenly sleep off. So these kind of signs actually say that we can pick up that this patient might be having the obstructive sleep apnea. And of course, this is have a treatment, and we can have a machines now called CPAP. We can keep the CPAPs in the night so that the obstructive sleep apnea, apnea spells will come down. The next most common thing is these diabetic patients also have, don't follow the sleep hygiene. They'll be waking up till midnight. They'll be, because of if you don't fall asleep on the particular time, then your hormonal changes will change. Hormonal changes will happen. Ghrelin will increase, leptin will decrease. This leads to excessive intake of food. That's why the many people who are working in the midnight, they tend to end up in eating more food, and that leads to obesity also. So what should we do? One is time. You have to go to the bed on time, and diet and exercise to control your obesity so that it will control your obstructive sleep apnea. Consult your doctor for proper diabetic management. Like you have to avoid high sugars, you have to avoid low sugars, and before going to bed, they should not have coffee or smoking, alcohol, these kind of things, because that will stimulate your brain. And if you have any health issues, you always ask for a professional help to tackle with depression or anxiety. These are the things you need to keep in mind for a proper sleep. Thank you.